Joining us now, MSNBC medical contributor and former Obama White House policy director, Dr. Kavita Patel, former member of the Biden-Harris COVID-19 Advisory Board and former assistant administrator for global health and at USAID, Dr. Atul Gawande, and staff writer for The Atlantic, Mark Leibovich. And Dr. Gawande, the acting head of the CDC is a critic of the agency. You wrote on X, has America run out of actual health practitioners with demonstrated experience improving public health outcomes? So what's your reaction to Jim O'Neill assuming this role, at least in the interim?
For the last 70 years, CDC has been headed by medical professionals with long experience demonstrating improved outcomes in public health. And now we have in place someone who has none of that track record. And in fact, the RFK Jr. and Trump have backed one person after another who do not adhere to the scientific process. That's what the people at CDC were being removed for, adhering to a scientific process. So, Dr. Gawande, I received a text from a very prominent infectious disease expert who told me, I worked with all those people. He's referring to all the people who resigned, or Dr. Menares, who was fired. They were both historical knowledge and future leadership, totally gutted. I don't see how we come back from this. Do you share that bleak outlook? I do. Look at the process. This is how USAID was dismantled. First, you purged staff. You then gutted the funding and hobbled the ability to actually execute on anything before it was finally dismantled. This is the same process that's been occurring at CDC. Funding has been reduced. Whole areas of work has been stopped, such as HIV prevention, such as being able to do diarrheal surveillance for all the different diseases that are common across the United States. And now we have the removal of the top leadership for simply trying to make sure that CDC is being able to present evidence. They haven't even been able to get a meeting with RFK Jr. around decisions he is making about vaccines. And Dr. Patel, I want to get your response to the news that now CVS and Walgreens are both clamping down on the COVID vaccine in more than a dozen states, in some cases requiring a prescription. How much harder does it make it for those who actually need the COVID-19 shot to get it? And what does this signal to you?
Oh, it's incredibly hard. And we were expecting this, not necessarily this soon, Ariel, but we knew that some of the changes that happened, not just in the recent days, but this has been building starting in June with the replacement of the Advisory Commission on immunization practices by RFK Jr., firing basically people with expertise that Dr. Gawande mentioned and replacing them with people who are still currently known vaccine skeptics and have been stoking misinformation. So what is it actually translating to on the ground? Ariel, people, including people in my own family, have no idea. Can they get the vaccine? Can they get it today? Do they have to pay out of pocket? What will happen? What do you do for your children? What if you don't have a high-risk condition? What are those conditions? What if you're a pregnant woman? All of the information that's been thrown around is confusing, and it's all coming to a head at pharmacies and doctors' offices. Guess what? Trying to get a prescription, not going to be that easy when you can't get an appointment. So these tensions are just going to mount, all while we're seeing an uptick in cases and we're entering a respiratory virus season.
Yeah, I already know people who are going down with COVID at this moment. Dr. Patel, right. Secretary Kennedy sent a letter to the CDC staff saying that they are looking to, quote, restore trust in the agency. Do these moves do that?
No, the restoration of trust would have happened by not replacing the Advisory Commission, by not creating the cuts that took away career staff who work on data sets, who work on hospital surveillance mechanisms, who work on wastewater surveillance. The trust was eroded, Ariel. We don't even talk about it because so much has happened. There was a period of time where they took down HIV PrEP, COVID, all these information pages from the CDC right after inauguration. That's when trust went away. Care for transgendered individuals. That's when trust was eroded. To get that back is going to take real leadership and real courage. And some of the most courageous people that I know in public health have walked out the door, have been forced out the door, and their names are prominent. And you've talked about Dr. Menares, but there's so many others behind her and in front of her that have had to step down because this weaponization, as others have referred to.
There have been a lot of people who have been critical of the CDC, the stance on lockdowns, and how the COVID-19 pandemic was handled. But that is a far cry from seeing some of the measures that we're seeing against vaccines that have been tried and true in the past. Mark, President Trump told RFK Jr. to, quote, go wild. He has not seemed to waver in his support of Kennedy, even when he ended that funding for mRNA vaccine research to the tune of $500 million. Trump has also told his donors in the same breath that those vaccines were one of the biggest accomplishments, Warp Speed, one of the biggest accomplishments of his first term. So is the president in lockstep? Is the president agreeing with some of these moves that Kennedy is making here?
It's a curious question because objectively, Warp Speed was, I'd say, one of the 2 or 3 best accomplishments of his first term. I mean, getting the COVID vaccine developed and distributed as quickly as they did was an extraordinary thing. And of course, he can't really talk about it because many people in his base are deeply upset by vaccines and have been influenced by the stuff they see on the internet and so forth. And obviously, RFK Jr. has been a prime driver of a lot of this information or misinformation, if you sort of look at it that way. I think the other part of this is, and I hate to reduce very serious medical and scientific issues to a political issue here, is that in the last week or so, or last few weeks, this has become a real political distraction for President Trump. And the CDC is an organization highly respected until fairly recently, which people have sort of looked to for guidance, but also as a apolitical and sort of purely scientific force in the government that they can look to for reliable information. And these are not, low-level people who are walking out the door. I mean, these are people who have worked their entire careers, are at the tops of their profession, and who bring real expertise to that organization and cannot be replaced easily. So Trump obviously is watching this and seeing what kind of attention he's getting. And it's also you also have to wonder at what point he gets a little bit weary of the kind of roughshod treatment that Kennedy is visiting upon a lot of these institutions.
So, Mark, though, this begs the question, where is Congress in all of this? Is there any oversight of what's going on at the CDC? I know that this seems to be mostly politically driven, but you have senators like Cassidy, who's a physician himself, who actually voted to confirm RFK Jr. You have Susan Collins expressing their displeasure with what they're seeing and saying to hold up on any kind of decisions on vaccines. So what is Congress doing? Obviously, Democrats are expressing their concerns as well. What can they do?
I mean, Congress had their opportunity to weigh into this largely when RFK was up for confirmation, and there were a lot of officials that came before them. They asked questions. I think obviously Cassidy has probably got someone who's gotten the most attention because he raised the most questions. In the end, as you mentioned, he came around and supported RFK, and has been his certainly most visible backer. He probably has second thoughts, but he hasn't really talked about it that much. At this point, certainly they can raise questions. They can call people in for more hearings, but you sort of have to wonder, is anyone going to listen to them at this point? They had their chance to really weigh in. They did, and they sort of forfeited their influence several months ago. So I don't know how much good it could do at this point, but obviously they're still there, so they can speak. They have a mantle. You got to wonder what good it does at this point.
Yeah, and we'll see if they take this up, given the heavy lift that they're going to have when they get back in session. Dr. Gawande, Dr. Dimitri Daskalakis, who directed the National Center for Immunization and Respiratory Diseases, which oversees vaccines, wrote in his resignation letter that the vaccine committee, quote, ignored all feedback from career and staff at the CDC. So I got to ask the question, who is left to guide these critical issues of public health and these decisions?
Yeah, who is exactly advising and writing up what RFK Jr. is putting out right now about vaccines is a mystery. There is not, in fact, a transparent process or gold standard science that they argue they're trying to deliver. It's a shock to find out that CDC experts who have produced reviews of all of the evidence and research that are out there about vaccines like the measles vaccine or other ones that are up for discussion, were not even allowed to brief RFK Jr., could not get appointments, and have no idea where the write-ups are coming from. All they could note was that the work was shoddy, that there was manipulated data and predetermined conclusions in what's being put forward, and that's why they had to resign.
Good evening from New York. I'm Chris Hayes. We've got some breaking news just now on the central economic policy of this Trump administration. In a huge blow to the White House and its agenda, and a big win, I would say, for everyone else, a federal appeals court has just ruled that Trump's sprawling tariffs are unlawful and invalid. Of course, the president has been obsessed with imposing his willy-nilly tariffs on Americans. In fact, it has been the central plank of his entire economic agenda. Now, it has been wildly unpopular. It's polling underwater. It is costing consumers and corporations billions and billions of dollars by the day. It's stopping the Fed from cutting interest rates by driving inflation. It has, on the whole, been really bad economic policy. And most of the discussion of these tariffs have been focused on that. But there's also something about these tariffs, which is that from the jump, they've been pretty clearly illegal. I mean, think about it for a second. Can the president just by himself create tariffs that raise hundreds of billions of dollars with zero congressional input? These tariffs are a violation of the law that they purport to use as the justification, and a violation of the spirit of the Constitution of a country which was quite literally founded on the belief the executive cannot unilaterally just impose a tax without representation, specifically tariffs. Now, the Trump administration has claimed that its tariff regime and the reciprocal tariffs that it has, and those on China and Mexico and Canada, that those are an emergency measure under a 1974 law, and that made it legal. Well, when this was challenged in a district court, the district court judge said, no way, this does not comport with the law. So the Department of Justice, acting as Trump's lawyers, appealed. And now, just 20 minutes ago, in a huge development, an appellate court has just upheld that ruling 7-4, the federal appellate circuit, saying it is illegal. All the tariffs you're citing are illegal. The emergency you claim is not a valid basis to break the law. Neil Katyal argued this case on behalf of the plaintiffs who just emerged victorious. He previously served as acting Solicitor General of the United States, and he joins me now. Neil, frame the argument that you made and what the court said about those arguments.
Yeah, so I want to begin, Chris, by saying, like you started by saying it's a blow to the President Trump. The way I really think of it is it's a win for the Constitution, and it's always, a very serious, sober thing when you challenge presidential action, and something you have to do really carefully. But when we looked at this, and I'm privileged to represent a number of small businesses, we looked at it and said, look, this just is way beyond the constitutional pale. And that's what the 7 judges today said on our nation's second highest court. They looked at it and said, the president under our Constitution is given no power to impose tariffs. Our founders expressly gave that to the Congress in Article 1, Section 8. And President Trump himself recognized that last time when he was president. He went and asked Congress for the authority to tariff, and they said no. So President Trump this time around just did it on his own. And what we said is you can't do that under the laws and Constitution of the United States. And that's what I'm glad to see the court reaffirm today.
Yeah, I thought this is an interesting phrasing. This is the federal circuit, which is an interesting and unique appellate circuit that deals with certain jurisdictions, including international trade. They talk about the 5 executive orders that impose tariffs of, and they say, unlimited duration on nearly all goods from nearly every country in the world. Which I thought was, when you put it like that, you think to yourself, yeah, that does seem like a pretty broad claim of executive authority.
Yeah, as broad as it could get. And I think this is one thing that the judges were concerned about, and certainly we've been thinking about, which is the Trump administration is saying they want to bring this case to the Supreme Court. And this U.S. Supreme Court for many years has been saying, in particular with respect to a lot of different President Biden's initiatives, these questions are too major for the president alone to decide. They have to be done by the Congress. And here you got something as major as it gets. The Nonpartisan Tax Foundation says that these tariffs are the largest tax increase on Americans since Bill Clinton in 1993. And yet Congress had nothing to do with them. It's just President Trump and the stroke of his pen. And that just can't be the right way to run a constitutional system.
It's been interesting to cover this as we have, because so much is focused on the concrete effects. I mean, right now, if you're buying coffee, for instance, you notice that coffee's gotten very expensive. We don't grow a lot of coffee in the U.S. There's a little bit in Hawaii, but we import a huge amount of coffee. That coffee is being tariffed. So there's all sorts of effects, but the discourse didn't really talk about the legal foundation. The argument that they're making is that there's a 1974 act that allows them to declare an emergency under which they can impose these tariffs. But what's interesting about that act is it doesn't use the word tariff at all. It's entirely about sanctions on essentially countries that we have some geopolitical adversarial relationship with, right?
You're exactly right, Chris. You're doing excellent lawyering. I suspect it's in part due to your spouse, who's an amazing lawyer in her own right. But that's exactly right. The government is saying, in this case, the Trump administration is saying that in 1977, Congress passed a law that gave the president emergency economic powers. And the court today said, yeah, that's true. There's only one problem with that. That 1977 law says nothing whatsoever about tariffs. No president in the 50 years since that law was passed thought it had to do with tariffs. And as I said a moment ago, even Donald Trump didn't think it had to do with tariffs, because the first time around when he was president, he went to Congress to try and get the tariff authority that he's now asserting. And Congress said no. And I suspect, he's worried Congress would say no if he asks again, for all the reasons that you were explaining earlier.
One of the things here, and I want to read again from this decision here, that this is the sort of core of the holding. For the reasons discussed above, we discern no clear congressional authorization by IEEPA, that's the 1977 law for tariffs, of the magnitude of the reciprocal tariffs and the trafficking tariffs. Reading the phrase regulate importation, which is the statutory language they're citing, to include imposing these tariffs is a wafer-thin reed on which to rest such sweeping power. How confident were you about winning this case? I mean, you obviously had the lower court on your side, but also courts have been fairly deferential to presidential declarations of emergency powers.
Yeah, no, when you're challenging presidential action, if you're the president facing these challenges, you almost have to try to lose the case. It's like failing kindergarten. You got to try. But I think that's unfortunately where we were here. And that's why, I'm privileged not just to represent this myself, but with a whole group of very conservative folks. The Liberty Justice Center is the entity behind this, a libertarian organization. Judge Michael McConnell, a very prominent former judge, very conservative. It's not, this is, when you get to something like this, Chris, the Constitution is not political. It's a bipartisan document that speaks to all of us, and it sets certain ground rules. And one of those ground rules was enforced today. The idea that the president on his own can't tax the American people. That's what King George III tried to do. We had a revolution about that.
Yeah, final question for you. I think this is probably, we're not at the Supreme Court yet, but probably the most significant ruling in restraining assertions of power from this president since what happened with Kilmar Abrego Garcia, which did go up to the Supreme Court. The big question is, how confident are you? The Supreme Court's almost certainly going to take this up. How confident are you there?
So I'm very confident in the merits of our argument, Chris. I think it is, rock solid, extremely strong. And I know that there's sometimes some in the public who say, well, this is a court that's dominated by Republican appointees and the like, and you can never get a, liberal victory or something. And I have two things to say that. Number one, this isn't a liberal victory. This is a victory for the rule of law that conservatives and liberals should celebrate alike. And number two, the court has shown time and again that it can reach conclusions that are at odds with conservative ideology when the law says so. And, when I argued Moore versus Harper, and we talked about that a couple of years ago, is a good example. So I think let's let, the process play out. Our hope is that the administration doesn't appeal this, that they go to Congress and ask for the authority that the court says. That's what the Constitution says they should be doing. But if they do decide to appeal it, we will be ready at the U.S. Supreme Court for them.
Stephen Miller just posting on social media, the judicial coup is out of control. Those are his words, presumably in response to this. Neil, thank you so much. This was a last second coming to join us in this breaking news. I really, really do appreciate it. Have a great weekend.
So, Doctor, let's talk about the CDC, and particularly, I want to play part of what Dan Jernigan had to say. He's one of the officials who quit after the Trump administration targeted this CDC director. Take a listen.
I've been at CDC for over 30 years. and doing lots of different infectious disease outbreaks, et cetera. I've been through a lot of administrations, including the first Trump administration. This is different. The character right now is one of questioning, of a lack of respect for the science, and an approach that really is looking to find answers for things where there might not be an answer.
So that's 30 years of experience, Zeke, that's gone. And it's safe to say that he, along with the others who left, are among the foremost experts in their fields. How hard is it to effectively run an agency when you lose leaders like that and all at once?
Oh, they're not trying to run an agency. They're trying to totally undermine the agency and get the agency to do what RFK Jr. wants to have happen. It's not just turmoil, it's destruction. They have reduced the amount of data they have. They've pulled off their website data that the public could get. They are issuing guidelines about vaccinations that don't comport with the science. That's what led to this latest outbreak or the latest set of resignations. This is, I don't think we're at the start. I think we're well into the play here of dismantling the CDC as we know it. I think a lot of pressure has to be on Senator Bill Cassidy, who heads the HELP committee, that's Health, Education, Labor, and Pensions, and has oversight here. And he supposedly claims he got an ironclad letter from RFK Jr. before he voted for him for confirmation that he wouldn't disrupt vaccine policy and vaccine approvals. That is clearly RFK Jr. is disrupting it, trying to totally undermine the oversight of vaccines and the using science to determine which vaccines should go and which patients should get them. This is a very serious issue. Many thousands of Americans will end up being harmed by this. Some will even die. I don't think this is trivial. And Senator Cassidy has to draw a line, and he has to say very clearly in the appropriations bill for HHS what he expects, including reconstituting an advisory committee on immunization policy that has scientists and not simply anti-vaccine advocates who are intent on not following the science and dismantling the regime that we know that has given us safe vaccines, many of them.
Well, what are the chances of that, Vaughn Hilliard? I mean, if indeed, as Dr. Emanuel has said, the goal here is not turmoil, and we talk about how Trump likes to create chaos, but if the goal is not turmoil but destruction, tell us what's happening from the White House perspective.
Well, just yesterday from the podium of the briefing room, Caroline Leavitt was asked about these firings and resignations, and she said that, in fact, the president and the White House directed and backed Secretary Kennedy's moves. And I think it's important because, well, the president likes to tout Operation Warp Speed and the administration's response to the COVID pandemic. Ever since he began running in 2024 as a candidate with the endorsement and backing of Robert F. Kennedy Jr., he has sided consistently with him. And even in the week leading up to the 2024 election, Chris, from the campaign stage, he said that Kennedy would be allowed to, quote, go wild in his administration on health. And when it came to vaccines, he said that he was going to let him do, quote, whatever he wanted to. That is exactly 7 months in the type of power that he has handed Secretary Kennedy. And despite questions of whether this is Donald Trump's actual position and whether he actually wants the CDC to operate in this way, time and again, he has given Secretary Kennedy that exact power. And even earlier this week at that cabinet meeting that Secretary Kennedy attended, President Trump brought up the idea of autism and the, quote, horror of it and asked Kennedy how that was going. Kennedy doubled down and said that his department has been studying autism and its roots, and he would be releasing a report in the coming weeks. And so this is, to the doctor's point, only the beginning of what this department has sought to do. And that is where we heard directly from Dr. Jernigan and Dr. Ori, the chief medical officer, concern about the allies within this department of HHS and what their intent is to do with the numbers and science that exist, and what they intend to present to the public, in whether a typical scientific integrity clearance process is going to actually be followed before they disseminate it largely.
Well, Brandy, speaking of letters, as Zeke did, and the promise that was made apparently in a letter to Senator Cassidy, RFK Jr. sent another letter yesterday, and the way I read it was that this is all fantastic. Let me read a little bit of it. Reform does not diminish your work, it strengthens it. The American people are ready to believe in this agency again if we show them that integrity, accountability, and science guide every decision. Together, we will restore trust. Was there a legitimate question of trust out there? And where does this leave the other folks who work at the CDC who may be troubled by it? But let's be realistic. Not everybody has the personal financial ability to walk away.
Yeah, I mean, that letter, I've been talking to about a dozen sources inside CDC, and the general feeling is, how dare he? How dare he spoke another letter to us in the trappings of science, using the words of science, but that aren't scientific at all. When you talk about trust, overwhelmingly, the people inside the CDC, who they trusted are the people who just walked out the door. It is Jernigan. It is Dr. Dimitri, Dr. Oury. And so with those people gone, their question is, who will be the bulwark between us, the people, the staff scientists and the workers and the epidemiologists, and Kennedy, who has tamped down their work, who has stopped them from doing their work, who has stopped them from producing and communicating their work, and only seems to be concerned with this autism question that has obsessed him and it's been his occupation for 20 years, proving this point. And so it's really, really sad inside the CDC right now. People do still have jobs. Hardly anyone is working, I'll tell you that right now.
Really? All right, which brings me, Dr. Emanuel, to this question of an autism report that could come within weeks. Who's going to write that? And by the way, the White House has named RFK Jr.'s deputy as the interim CDC director, a guy named Jim O'Neill, someone who has no medical experience.
Can I just say one thing?
Yeah, of course.
Which is, or two things. First of all, I do believe through personal communications that Donald Trump also believes what RFK Jr. does about the link between vaccines and autism. I don't think this support is casual, and I don't think this support is something that he's just come to. He has a belief about it. He asked me personally about it. The second thing is Jim O'Neill is.
Can I ask you about what was his question?
Do you think vaccines cause autism? And I explained why that study in the Lancet that started this whole thing is wrong, retracted. But I don't think this alliance between the two of them is casual. The second thing I would say is Jim O'Neill is a political appointee. He doesn't, as you point out, he's an investor, but doesn't have scientific experience. He can stay there 210 days. I think Senator Cassidy is the critical player here to make sure that whatever is left of the CDC can be protected and it can rely on science. And I think he has said we're going to need more oversight. I think it's going to have to be more than just oversight. He is going to have to critically dictate what he thinks the CDC has to be, HHS has to do, and the secretary has to do to preserve the CDC. And I agree, the language that RFK is using is very Orwellian. It's using words in their exact opposite meaning, and that is really, really disturbing. That's a classic example of how people don't begin to trust anything when you say we're restoring science. We're not restoring science. He hasn't used one bit of data that has passed peer review and the community agrees to.
Dr. Emanuel, I know you have another commitment and have to go. I want to thank you for your important information there. Michael, let's talk about Bill Cassidy, the senator from Louisiana, who besides being the head of a key health committee, is a doctor, who's married to a doctor, who founded a community clinic in his home state of Louisiana. Is he capable of doing what Dr. Emanuel says needs to get done, to critically dictate what needs to get done? What power and will does he have, do you imagine?
So he's a United States senator. He's more than capable of doing exactly what Dr. Emanuel said. Will he? No, I don't think he will. There's not a Republican in the United States Senate has done anything in the last 10 years that would lead us to believe that in a moment like this, they're going to stand up and say to the American people, we side with you. That's not how. Why are we pretending that Bill Cassidy is going to do something different than any other action he's taken up till now? He voted for RFK Jr. in the face of RFK Jr.'s family saying, please do not put this crazy man in this job. And he voted for him. He got a piece of paper saying what? He believed that crap? Come on. Why do we play this game? This is not, we're expecting this man to do something that there is no evidence he's prepared to do because what? He doesn't want the wrath of Donald Trump on his head. He doesn't want to be outside of the MAGAverse. His Senate seat is valued less than his support for Donald Trump. The people in his state, their health and their concern is of less value to him, as it is for every senator who's voted for this guy, who voted for RFK Jr.
So
we can't
we're out of time, Michael, but I want to ask you,
because
this is the important question then. If all of that is true, and there's a ton of people who agree with you, what's the average American to do whose lives or their ability to have a good life depends on a functioning CDC and FDA?
Buckle up, baby. You're going to be sick. They're going to the explosion of measles this academic year in schools across the country is going to be we've seen what happened just in the first part of this year in places like Texas at the end of the school year. Now we're about to go into a whole new school year, and the idiocracy that's running our health care is saying, children don't need to take have the vaccines that they need to protect themselves and other kids. So yeah, people are going to get sick. People will die. And people won't have access, as we've said up to this point, will not have access to the information they need to keep them healthy and to save their lives. Because the data is BS. It's made up. It's not real. We all know what this autism report's going to say. You think after all of this, they're going to put out a report that confirms that there is no link between vaccines and autism? No, we already know the report's what it's going to say. And yet the press and the politics are going to pretend like this is somehow going to be news. They don't need to go study. What study? So I think Dr. Emanuel's right, and Dr. Jernigan and others who've been saying that the data is the key thing that goes a long way to keeping us healthy. When that is bad, when that information is bad, the consequences to the American people are bad. And so I don't know how you get around this. I mean, we can talk to Bill Cassidy, but Bill Cassidy is not going to do anything that Bill Cassidy hasn't done before because he voted for the man who's created this mess.
I want to pick up on something. Neil Katyal argued this case. He says his hope is that the administration does not take this to the Supreme Court, but in fact takes it in the direction that the court suggests, which is Congress to discuss this. I have no such hope. On one hand, Congress seems to do Donald Trump's bidding. On the other side, these people have been facing these town halls at all times and understand that Americans do not see the benefit of sweeping, unrestricted, unbounded tariffs.
I think it's obvious that going to Congress is not on the agenda of the Department of Justice. As you said, they've already said that they're going to appeal. What is peculiar about the case is not the merits. On the merits, I think Neil Katyal is right, and the 7-4 decision of this court was clearly right. The International Economic Emergency Powers Act delegates all kinds of authorities to the president, more perhaps than the framers would ever have imagined. But it does not delegate to the president the power to basically replace Congress's carefully designed tariff scheme with tariffs of his own across the board on virtually every country, on almost every product. There are targeted tariffs that the court did not strike down. They didn't strike down the tariffs on various implements that might be relevant to a war, national security, steel, that kind of thing. But the across-the-board tariffs and the tariffs that the president is using, for example, to punish Brazil because its Chief Justice wants to hold its prior dictator, Bolsonaro, accountable to the law, and Bolsonaro is a friend of Trump's. That kind of thing is not within the International Act. But that's just the merits. The posture of the case is a slow-walking posture. Not only did the court say that it would suspend its ruling's effectiveness until mid-October, but it also sent the case back to the Court of International Trade to reconsider the propriety of a universal injunction in light of the criteria that the Supreme Court invented to limit those injunctions in the case of Trump against CASA. So the case is going back to the trial court. The trial court, it confronts a very complicated issue about whether this is one of those cases where universal injunctions are appropriate. While the trial court is considering that issue, the administration is appealing to the Supreme Court. The Supreme Court has all kinds of procedural things it could do to slow walk things. It can say, well, until the trial court has decided whether to uphold the universal injunction that it initially entered, we don't have to do anything. Remember how it slow walked all the president's criminal appeals. So we could see this going, into and past the midterms, for heaven's sake.
Yep.
And in the meantime, these obvious exercises of power that really belongs to Congress will stay in place. One of the interesting things about the opinion is how it reached into the debates for ratifying the Constitution. It recalled that Tom Paine asked the key question in the convention debate: how can we tell that this president will not become a king? And the answer that James Madison gave him was, well, he can't become a king because we haven't given him the power of the purse. It's only the people's representatives who can reach into their pockets.
Right.
And what this president is doing is reaching into everybody's pocket by imposing a tax.
Yep.
Taxation without representation. I think I heard that slogan somewhere.
But he claims they're all paying it. That's at some point, I don't know how many times we can explain to people, you pay it. You or whoever sells you the goods pay it. But it's at that level. It's not. China's not paying it. One of the things the president said, and one of the arguments that he's used with respect to why this should be in his purview, is that these are international emergencies, and sometimes he talks about fentanyl or whatever the case is. He has said, he posted on social media in response to this decision tonight, he said he rebuked the federal appeal court decision, warning that a court order blocking his tariffs, quote, would literally destroy the United States of America. Literally destroy That's actually just not true.
Well, well, apart from that, if there's anyone destroying the United States of America, I think I know who it is, and he lives at 1500 Pennsylvania Avenue. That's what's destroying the country. If anything, he's ripping apart the Constitution, paying no attention to its limits, basically saying if he wants to do it, he can do it. And we are confronting a situation in which it's very, very hard to stop him in time. And this decision is a good harbinger. And by the way, of the 11 judges, not one questioned that this was a tax. Of course it's a tax. The question really is it a tax that Congress has authorized?
Right.
And the court has said that, as Mr. Katyal pointed out, if something is a major question that affects the whole economy, then we don't assume that Congress has given the president the power to do it just because there are some words that might include it. And here, the only words they could find are the words regulate. It gives the power in response to emergencies to regulate. And interestingly, the Chief Justice of the United States, in the decision he wrote upholding the Affordable Care Act, said that there is a profound difference between the power to regulate and the power to tax. The power to tax, John Marshall said very early in our history, is the power to destroy. And this court carefully, this 11-judge court, didn't try to second-guess the president on these so-called emergencies. It could have done that, but that would have been vulnerable on appeal because there's a lot of deference to what the president regards as an emergency. It said, emergency or not, Congress has not given the president the power to do this in response to these emergencies, even if they are emergencies. So on the merits, the president does a very weak case. But in terms of dragging it out, doing what's illegal until it's too late to undo the catastrophic damage he's doing to the economy, there he's still ahead.
And therein lies the rub. Professor, I always feel, not that I'd have lasted more than about an hour in any of your classes, but I always feel like I'm getting a bit of an education from you. I appreciate that. Professor Laurence Tribe.
Thank you.
Harvard Constitutional Professor Emeritus.